Sounds like Boston's got some rain today. Excellent. Thank you for joining us, Adrienne, Mariana, Nayla. Looks like it's time for us to get started. Thank you guys so much for joining us. We really appreciate you taking some time out of your day to be here with us as we discuss our roundtable topic. So today we'll be discussing the Executive Order 14224 and what it means for language access and compliance. So Executive Order 14224 is the order that made English the national language of the United States. The conversation is going to bring together leaders who work on the front lines of language access every day. I'm going to ask my speakers here to go ahead and introduce themselves. Go ahead, Selma. Let's start with you.
Thank you, Elizabeth. Hello, good afternoon or good morning, everybody. Well, yeah, depends on what part of the country you're in. My name is Selma Kelly Alford. I am the formal Bureau Director of Language Access for the Mississippi State Department of Health as of a few days ago. So my expertise come from a lot of years of working in the field on making sure public policy around language access being implemented. In the last 5 years, I've been working with community organizers, community health workers, and teaching interpreting classes. I published a couple of the language access plan for the health department, most recent one, the 2025. And of course, as y'all know, COVID-19 hit us and interpreters were on the front line and needed making sure those access was available for the constituents of Mississippi. And that's my short version of me. I'm looking forward to this chat.
Thank you, Selma. It sounds like you're going to be a wealth of information today. I'm really looking forward to it. Hi, Hannah.
Good morning, good afternoon. I am in Washington, D.C., so here it is good afternoon. My name is Hannah Groff, and I'm the Language Access Manager for a small cohort of elementary and middle school charter schools here in D.C. We teach students age pre-K 3 up to 8th grade. We have a lot of immigrant families that we work with, many families that are in our ELD or ESL program, a lot of students in that programming. So a large part of my role is making sure that our families can communicate appropriately and cohesively with our staff and teachers, making sure they're up to date on all the information about what their children need, what their children are receiving at school, answering questions, making sure, just families are connected with the school and vice versa. So my work involves interpreting, translating, working with our contract interpreters, training teachers, just all around language access for our families. And I also support in the ELD program with compliance and just, I'll do a little bit of everything here, but I'm thrilled to be here with you guys today. Thank you for having me.
Awesome. Sounds like a big role that you fill with all of those responsibilities, and things are always moving, I'm assuming. But thank you so much, Hannah, Selma. It's so great to have you here today. Hi, everyone. My name's Liz. I am the language access expert with Effectiff, and today I'm your moderator. So we're really looking forward to digging into this conversation. And today we're going to explore the implications of the new order, from legal responsibilities to operational realities that it will create for schools and healthcare systems, as well as public agencies. We'll also discuss how collaboration across sectors can strengthen compliance and ultimately ensure equitable access for individuals, regardless of the language that they speak. So super excited to get started, guys. We're going to begin with our first question here. It's going to pop up on the screen for the audience as well. So when you first read Executive Order 14224, what was your immediate reaction? And what went through your mind as someone who works closely with language access every day? Anyone want to start?
I was about to ask Hannah.
You go ahead, Selma. Go right for it.
Well, I'll start. Thank you for that. That was an interesting question. I think the first time when I read it, my mind blew up in so many different levels. I think I read Executive Order 14224 about 5 to 6 different times, trying to avoid the bias within it, me, because in public health, writing policy, one of my main focus and view is how to be unbiased and make sure that I make the right decision for the community, for the constituents that we serve. It's a very robust read. It's a hard read, especially when you are so familiarized and so in tune with the previous executive order. But something that it's very important for us to recognize and always come back and bring it to the full front. Executive orders can be changed, right? It's present for this current government. That does not mean that it will apply for the next one. So really going back and honing on Title VI and making sure that when we write policy, when we work with our constituents, to really hone in on what is the legal basis, because that's a federal law. It sticks no matter what. So when I went ahead and updated the language access plan, trying to be non-political, I highlighted Executive Order 14224 underneath Title VI, but I did not go in depth into it. That's my take. Hannah, did you have a different? What was your take?
Yeah, so I would say the first thing that went through my mind, honestly, was just sadness. I feel like we work so hard to celebrate language diversity and like the background of what's being spoken in the home by our students, by their families. And I just was, it's just hard to read knowing how it just is such a different message than I feel like what we work for and what we share. And yeah, just knowing that we have diverse populations and all the cultures and languages that go into it, pushing the idea of English as being like something above what they're speaking was difficult and was hard. So yeah, it was not a happy read, I would say. And it just, I feel like a good portion of my job is trying to make our families' lives easier, and it just felt not that. So, but that was honestly, yeah, some of the first thoughts that I had is just, how does this affect the work? But also just like on an emotional level, what message is it sending to all the families that live and work here?
Yeah, as getting to that emotional level, I'm not going to lie. My reaction was rage. I was heartbroken. I was angry. And, trying to follow what Selma was saying, that, neutrality, the impartial, we're going to work through this. We're going to figure out solutions. It's not the end of language access, which is what I felt, at the time, like, okay, it's going to be okay. There are other tools in place that will ensure that we're providing these services as a country, right? It was frustrating. It was really sad. And I'm sure that our audience has a lot of feels about this as well. If you guys want to send in a little bit, we're looking forward to, hearing from you as well. And as Selma said, this executive order is temporary, right? We still have the ADA for people with disabilities, specifically the deaf community, which, as you guys know, I'm a former deaf educator, a former ASL interpreter, so they're always on my mind. But we also have additional requirements, right? That let's just back away from any kind of language access requirement and look at the fact that hospitals still have to save lives, right? They still have numbers. They still have, that data of how they're doing their job. Educators, educational entities still have to provide a successful education for those students. And part of that is having parent involvement, having community involvement there. There's nothing that is a greater indicator of success, really, when you're looking at education, than having those families and the community involved. So those are still there, right? This is not, it's not the end of language access, guys. It's not the end. It hurts a lot for sure. And just like what Hannah said, where, you know, this would be something that could make someone feel less than. And nobody wants that. Like, we don't want that. Language access should be an equal fire. And, you know, when it's not, it's very detrimental to everyone involved. So, you know, we do have a couple comments from some of our attendees, just that it's hard not to be political when you're addressing changes like this, because speaking a language other than English is being politicized. It really is. That's true. And another question about before I go on to the next question, did you guys want to add anything about that, about language being politicized in this situation? Yeah, please, Selma.
Yeah, most definitely. I completely agree, especially in the public health world. And when we start looking at how do we provide those avenues, and not just that, just looking at the country all the way around, what's going on in California, Texas, Chicago, you know, every city comes with a different background of emotions. And ultimately, I don't know about Hannah, but I know myself and my background, how I fell in love with language, and my passion was as, you know, being an immigrant kid, growing up, not knowing English and learning it and becoming proficient and still keeping my language, still helping my mother do the interpretation, which I probably shouldn't have at the age of 14, 13, right? But those are things that really stimulated us to really become passionate into being an advocate for language access. I think this particular moment of our lives is so critical, so crucial, what the country is going through, for us to stand firm and continue to talk, continue to advocate, and continue to remember our voices overall. It's very important. And yes, the political part is always going to be difficult. We always have to look at both sides of the round, but if we don't do that, it's really hard not to have a concise thought to be able to advocate for those.
Yeah, I completely agree, Selma. And living in DC, it's obviously an incredibly liberal town. So I'm a little bit of a bubble as far as like politics goes. So I feel, you know, lucky to work with other people and live in a community that really does value diversity and culture, and any type of language under the sun can be found here in DC. So I do agree it's hard not to make it incredibly political, but at the end of the day, this is a political executive order, right? So it's based in politics, even though it has real world consequences in the work that we do and how our families, clients, whatever language access kind of sphere you're in, how they're experiencing day-to-day living as well.
Absolutely. Adrienne, we are going to be talking about schools and the impact that this is having on them. So I just wanted to let you know we are going to get back to this one. One other thing that I just wanted to throw out there from our comment section is someone mentioned that, you know, language access is being framed as a burden. Have you guys kind of picked up on that feeling? Not you personally, but like, have you kind of noticed that is the part of the conversation, that's part of this polarization that we're experiencing?
Absolutely. Sorry, Selma, I was just going to jump in. You know, I think we've all seen like those horrible videos of being like, speak English, we live in America. Like it is, it really, I truly feel that if you want to put English on a pedestal, then there's probably something else going on with you as far as like, you don't value those other things. So I definitely think language access is kind of like almost like an identifier of like, if you believe in language access, then you probably believe in this like plethora of other things, and, you know, human rights and all these other things that come into play. So being framed as a burden, I would say with this administration, absolutely. But again, I feel very lucky that in my circle and the work that I do, it's not framed that way.
Excellent. Thank you. Selma?
Yes, in reference to the word burdened, I think that for many, many years, I think with this administration, it really brings it in the forefront. But we have been hearing for many years, that phrase, "You're in America, you're supposed to know English," and kind of forgetting that we are a mixing pot. America, it's so great because of so many diversity, so much cultural, so much background, right? So yeah, we hear it. It's tough. It's tough. Language access right now is really tough. What the interpreters are undergoing is really tough. Those language access services agencies, what they're undergoing and how they're facing, it's really tough overall. But it's just moments like this where we definitely want to stand firm and continue to talk and advocate, because something that occurs when we stop using our voices and speaking for those that don't, things kind of cease and we become complacent to it. So this, thank you. What was your name, Patricia? Whoever put the comment there, that was a really good highlighted piece in terms of the how we are facing that burden piece. It's tremendous.
Absolutely. There's a lot of experiences out there, and especially when you're saying, as you guys both touched on a little bit, this is America, speak English, right? It feels to me like an executive order like 14224 is almost giving those people permission, you know what I mean, to respond a certain way when they hear any kind of difference in their community. And I think that part is what made me more concerned about it, rather than the very explicit, this is specifically for, government agencies, federal organizations, things like that. It gives out people outside of the government ammunition. It gives them confidence in what they're saying and what they believe, in a negative way. But we do have a question from Heidi. She said that she has been communicating with a Superior Court supervisor who said that, the Executive Order 14224 is specifically for government and federal agencies. It only affects them. Do you have any feedback about that? And what I'm kind of focusing on here is, like, yes, exactly, like the letter of the law is for government agencies, right? But it impacts in other ways that maybe you guys have seen when you're out there on the front lines. Selma looks like she might want to get in there.
Yeah, thank you, Elizabeth. Haiti, I think the key term is defining government, right? What falls under the government? The educational system falls under government. Every state employment falls under the government. So how do you separate the government with the private sector? Even when we start breaking down Title VI and how it affects, private sectors, right? They still receive governmental money in order, so that still applies to them. So when we start looking at what it affects and what doesn't, we all are liable. We all trickle down. That's a huge umbrella that um, we cannot walk away without being underneath it. So it's just something for you to kind of consider and think as you break down of how it really affects, because the government overall is the one that creates the laws, right? That we apply them. Every state agency that falls under any federal guidance, which is all of them, we adjust as it. So right now, what we are currently seeing is the federal government have mandated something, and state agencies are moving towards making sure that they fall online underneath those terms. And you see that earlier on in the year with the changes with CDC, HHS. So we cannot strive away from it.
Thank you, Selma. Hannah, anything to add?
That was very well said. So not really. I do agree with the definition of how it's affecting federal bodies in a more specific way. But I agree that there is a trickle-down effect. If you work in a school and you receive any federal funding, again, there could be implications for grants that you're able to receive around language access or different policies in that regard. I think we'll get into it more, but I think the easiest way to think of it is that there's no penalty for kind of ignoring that. So if you have the funding and you have the ability to continue to do the language access that you've always done, ramp it up, whatever your personal organization wants to do, there's nothing stopping you from do it. We will not get in trouble for continuing language access. And it even says that in the Executive Act, which maybe we could highlight. I can highlight it for you then. But so agree that it does have a trickle-down effect on many more agencies and bodies and schools, and maybe it appears on paper. However, at the end of the day, there's nothing saying that you cannot offer language access. So if you have it in your ability, if you have the funding to do it, keep doing it.
Excellent. Thank you so much. So in the chat, Bill Rivers has sent in a couple comments about this. One thing that he mentioned is that as of July, federal agencies are required to review their language access plans and exactly what they're providing directly to determine if it's still necessary. And he also mentioned that it's still very important for recipients that we know that recipients of federal funding are still required to provide language access. I'm glad that he points that out. And, one thing that I noticed about the Executive Order 14224, and please correct me if I'm wrong, they talked a lot about AI services, implementing AI to reduce funds and where possible. And that's something that the language industry is not quite there. We're working on it. We're making progress in that direction. But I just wanted to throw that out there that was something that was mentioned. And then also Bill also mentioned the Affordable Care Act is still in full force, and the executive order only affects executive branch agencies, not recipients of federal funding. And I think that that's also really important to note that we do still have the Affordable Care Act out there providing some guidance for us as a country. But I also want to mention that, Jorge Mija mentioned that there is a court of public opinion. And I think that that's a pretty big court. Everyone has an opinion about it. And it's really important to keep that in mind that, we all have our perspective and our experiences that have brought us here today. So thank you guys so much for all of the feedback. I know we're kind of getting a lot of response in the comments, but I am going to go ahead and move on to the next question because we are already almost a half an hour in. So like I said, ladies, it's a really good conversation. Okay, so we're going to go on to the next question. What legal risks do school districts or hospitals face if they implement English-only policies in light of Executive Order 14224?
Elizabeth, you want me to tackle that one
Yes,
first?
Yes, please. Thank you.
I think if we move towards that direction of only implementing Executive Order 14224, we're just going back in time. We're just going back in time. We've worked so hard to get to where we currently are, that we will be dismantling everything. I foresee a lot of legal issues in the long run. So many deaths and misinterpretation, misinformation. We just reverting back. So it's, as a practitioner, I believe it does more harm to only proceed on applying Executive Order 14224, then really looking at it holistic and applying other legal factors that will benefit our communities.
Absolutely. Thank you, Selma. Hannah, anything to add?
Yeah, just thinking about like specifically for schools, as it was already mentioned, we still follow Title VI. We have the Equal Educational Opportunities Act that we follow. DC language, and specifically has a DC Language Access Act since 2004 that we continue to follow. So none of this executive order trumps, for lack of a better word, trumps any of that guidance. So as far as like lawsuits or anything else, absolutely, it could be an issue. So that's why we continue to follow the previous law here in DC, and I believe nationally. So that's kind of why I think the small part in the executive order that states that there really isn't any there's no need, but there's not going to be any like you won't be in trouble if you basically continue to do what you're doing. Let me just read it in case anybody missed it, because I have it right here. This is directly from the executive order. Nothing in this order, however, requires or directs any change in the services provided by any agency. Agency heads should make decisions as they deem necessary to fulfill their respective agency's mission and effectively provide government services to the American people. So as soon as I saw that, I was like, okay, basically, not that you can ignore it, because again, referring back to what Jorge shared, the court of public opinion is important, and there is a lot of different perspectives on this. But at the end of the day, you would be in trouble, basically, for acting as if this was now a law governing our work, right? So it's an executive order, as they're saying in the comments. So all these other laws and acts truly still stand and trump anything that is in the executive order. So when I read that, I was kind of the only small glimmer of positivity that I took from it is that, again, if you're still able to have funding and the court of public opinion doesn't take anything else away, you can still provide the same language access that you always have.
Awesome. Thank you so much. Anything else for you guys?
No, I just want to keep reiterating, that we still have those other federal guidelines that really applies to it. For those of y'all that just because I know we're solely looking at executive orders, but there are other federal guidelines and that are in place to go ahead and really they're there to guide us and protect us and make sure that we continue to provide those services. As Hannah was saying, the executive order 14224, basically it gives you that green light not to provide it, right? But we also need to be mindful that we do have legal laws that requires us to provide it. So this is an order that it might not be standing in the next 3 to 4 years. So just remember that as we move along through the next 30 minutes, I did want to reiterate that.
Thank you. Thank you guys so much. Yeah, I think that a big part of this conversation today is just clearing the air, right? Let's get that information out there. Let's reassure the people that access is still here. We're still providing access. We're still out there ensuring that you get the help that you need. Heidi did just put a comment in, who are the American people considered? Does that include undocumented immigrants? So, anybody want to take that? We can just maybe have it as a comment. Thank you, Heidi.
Considered in the executive order, or considered in what we're saying?
Let's say what you are talking about directly.
Yes, the American people to me is anyone here that I am serving as part of our school community, in our neighborhoods. Anyone living here who requires language access should be considered throughout all this. Documented, undocumented, we don't care. If you need help to contact your teacher, your principal, anyone, you should, the speech pathologist, we're here to make sure that all the families can do so.
Awesome.
I believe that. Yeah, that's a really well put Hannah, because I believe that we are all Americans, rather you have documents or not. Because at the end of the day, we serve a purpose, right? We're working to chase that dream, regardless what's your background and where you come from, if you were born in this country or not. This country was founded by immigrants. So if we're going back to who is Americans, does that actually consider only the Native Americans? So yeah, I'm gonna leave it at that. I'm gonna pass back the mic to you, Elizabeth.
Thank you. Yeah, it is that Heidi, that's a loaded question. But I loved Hannah's response and Selma's. If you're here, you're included. So, and that's where we stand, and I love that. Really glad that we're getting so much audience participation. Guys, keep those questions and comments coming. I'm going to hop on to the next question here, and we may have already really covered it, but just in case, let's put it up. Where do you expect this order to affect daily operations the most? Scheduling, documentation, interpreter access, funding, and how might it change the work you do? Again, I think we answered that it's not going to change, but if you wanted to add in anything, please.
I don't, in my case specifically, I don't see this executive order having much of effect on our daily operations. If anything, because we're a small charter network, we kind of operate, we kind of do what we want to do in a way. We are a public school, but we don't fall under the huge umbrella of the DC public school system. Okay. So our CEO is incredibly connected and supportive in all things language access, immigrant supports, everything that we can offer. And so if anything, like throughout this year and even the tail end of last year, I feel like we're even like amping up our services almost as like a show of defiance, or Love just that. Like, regardless of what's happening out there and what, the administration is hoping will happen, we're going to do even more than we've ever done. So I have not noticed a difference in funding. Our interpreter access is the same. Scheduling, everything is proceeding as it always has.
Awesome. Thank you. How about you, Selma?
Yeah, I love that for Hannah. Because let's be quite honest, the type of leadership that you have on top is how things are going to really work and trickle, how much the effect is going to, really
Absolutely.
impact those community members. I see it. I think when I start looking at what impacts, I start thinking health equity. Yeah. And that falls under everything: interpreters, translators, CDC grants, funding. It all trickles down that same path, and ultimately what we'll see is the community members suffering if we don't steer and make sure that we continue on to push and pursue language access overall. We are all going to be affected. Health literacy is something incredible. When we don't have the knowledge that we need, how can we really pursue access to care? And language access falls intertwined in line, and that doesn't matter if you don't speak English or if you speak English, it still falls into a very big part. When we start looking at public health overall, that it all intertwines. It's no way that we can unwove language. It's the same way it's no way that we can unwove cultural. It's a part of us. So I do see it affected overall. I am currently seeing how it's affecting different states in different areas. So it's just being mindful to continue to advocate for those who are doing the work, those that are in the front line, and finding out ways that we can try to push forward that needle. Like I said earlier, Hannah, you're so blessed, so lucky when it comes to having someone that's really proponent for it, because that makes the load a little bit lighter when somebody else is working on the political piece and you're able to really focus on the needs of your students, of your teachers.
Absolutely. That's definitely something I think we should highlight. We're talking about language access, right? And we're talking about this executive order. And the executive order does permit, or I'm not even sure if it permits, but it suggests that other language access services are not required. Like there's not going to be a consequence for failing to provide services in certain situations. And, that's something that I'm wondering if you guys have seen any maybe outreach, or maybe families and community members reaching out to you to ask for clarification. What does this mean? How is this going to impact my students' education, my access to their files, healthcare, and the overall picture? Are you guys hearing from constituents and families that you work with?
Presently, more of the concern in this part of the country is getting picked up by ICE. So people's focus is truly getting to and from their home and their child getting to and from the school. So how much the executive order is even like in people's day-to-day thoughts, I think is probably minimal. Those that are like truly affected by other, life-changing violence, I would say. So I haven't, no family has come to me and asked me specifically, like, what does this executive order mean? But I would say, obviously a different topic, but like everything that's happening with ICE and all the anti-immigration sentiment has had a very large effect on our family's experience this year.
I'm sure it's very scary.
Yeah, on my end, Elizabeth, most definitely what I'm hearing a lot of the concern is definitely coming from those interpreters, those translators that are providing that access to those parents, to those doctor's appointments, because it directly affects them to a degree. Mm-hmm. Because what we're seeing is that providers are being more lean, right? Earlier on, as a language specialist, how many times we went ahead and said no to Google Translate so hard, right?
Yeah.
And now it's being promoted like, oh, you have Google Translate, use that in order to kind of deviate from paying that. As a previous state employee, what I was looking at is really advocating for language and seeing how this new federal year coming around, how there's been lost on access to language, access to translation contracts. All those things are falling apart, and they're not really concerned or paying attention on it because of this new executive order. So it's not saying that the weight is not being shown or seen. It's just, it's going to show in the long run. In the little glare right now, it's really trying how to reduce funding costs.
Yeah. Yep. Absolutely. We talk about the language access in the deaf community, right? It's often an afterthought. Oh, there's a deaf person. Oh, well, we didn't plan for that. Sorry. We don't have funding for that. Sorry. And this is something that the deaf community has been fighting for a very, very long time. And the spoken language community is also. And we're going to see it get worse and worse because of what you're saying. It's viewed as permissible to consider language an afterthought, to put it on the back burner. Oh, well, it's okay. We'll just put AI on, and they can maybe caption this meeting for you, and hopefully it'll be accurate and you'll get all the safety information that you need, but we don't really know what it's saying. So hopefully it's right. It's an afterthought. It's a, like you said, funding. Somebody in the comments said it's all about money and trying to make services as cost effective as possible. And a lot of that is going to fall back to AI at some point. It's not there yet, obviously, but it's definitely something that, will becoming this way. There's another comment that, this too shall pass. I know we talked about, like, yes, this is temporary, but it has the ability to do a lot of damage in the meantime, and having a lot of impacts. As Selma said, when we're talking about access to, contracting and language services, in that respect, like, those are often multi-year contracts. So if they're just kind of letting them go, those are things that take a very long time to get set up. And it's not something that you can just be like, oh, we're going to do this now. Now we have a new president. We're going to do this. Or, now this executive order is removed. It's going to take a bunch of time to get it set back up because it's not being taken care of now. And I could see that being an issue down the road. Okay, anything else to add about this one before I hop on to the next question? Great. You guys are amazing, by the way. It's been such a good conversation. We're going to hop into the next question here. In your view, how can different sectors, schools, healthcare, public agencies work together to safeguard language access under orders like this? I think that's a great question. Do you guys have any suggestions? What can we do?
I'll go first.
Thank you.
This was difficult. Before it used to be easy. And I said before, it was when we were all worried about COVID-19, the main priority was language, right? Interpreter services went up. They started realizing professional interpreters and how important it was to educate those interpreters. So
Absolutely.
We are moving into a phase that those same priorities, they're putting it in the back burner. So my thought is continue to advocate, continue to talk, continue to work with community organizations that are actually working with the community. Because what occurs is that as state agencies are working and pushing for the community, the truth of the matter is we're behind the desk. Someone else is out there actually doing the work, right? So they're partnering up with those different nonprofit organizations so the work can get done. So I think that's going to be the main focus moving forward, is how do we provide different access to be able to put our thoughts in the forefront and not leave it behind. Are we going to start talking more to our legislators to continue to advocate, or lobbyists? Definitely, it's going to all be compounded on depending on where you work, what your passion is, and how much you can do to make sure that you are working with those nonprofits and those individuals on the forefront. And I say that what you are, where you're working, and all that plays into play, because as state employees or federal employees, we all know that there's a certain amount of level of information that we can provide or that we can talk. So making sure that you are looking for those resources with those organizations that can really cause an impact, and for us to be able to partner up to some degrees, because alone we won't be able to do it. Nothing by ourselves we can do. So it definitely is going to take a lot from different people to come together. And trust me, conferences is always a great way to find those contacts, because Bill River was in this call. If you don't know about Bill River, he is a huge advocate of language access and things that we can do and how we can do. So meeting individuals like his statue is very important in order for us to really continue the great work that we have been doing, because we gotten here this far because the work has been done.
Thank you, Selma. Excellent. Thank you. How about you, Hannah?
So something you touched on a little bit earlier, Elizabeth, is connected to this for me. And you said, like, sometimes the breaking down of some of these like contracts or programming, it takes time to build it back up once, things have changed again and language access is being pushed a little bit harder. And so for me, that's thinking about this question, that's what came to mind, just continuing the the plans and the practices that you have in place now. Use the interpreters that you have, hire more interpreters if you can. Just making it part of the fabric of your organization, to me, helps safeguard and protect it. Just hire people, use people. Again, it's easier said than done. If you have a supportive CEO, board, whatever, whoever is making decisions about funding, that obviously has a huge is a huge component of whether or not how much you can push language access. So if you can figure out funding, it should still continue to be a priority. So I think, English being the national language, it really shouldn't have any bearing, or doesn't really have a bearing on the reality of what we do in this field. So at the end of the day, it's just kind of like white noise. And I so agree with what Selma said. If you can get in touch with like lawmakers, talk to your CEO if you feel like he or she is waffling on any funding or their kind of stance on it, like, get in a room with them and say, hey, where do we stand on this? Like, we need to take a stand on this. And so I would say, don't let it fall by the wayside because of, certain aspects. Again, if it's like a funding issue, like go to the top, who's in charge of some of these grants, where are they coming from? The more I think you can keep working with the interpreters, the translators, protect their work, protect the access. I just like that's how we're going to get through the next 3 years, is just keep doing what you can do with as much fidelity as possible. And I hope funding is there for everyone.
Absolutely. Thank you so much, Hannah. Oh,
May
Selma,
I say
please. Yep, I see it.
I'm sorry.
Go. No.
I forgot our main priorities as public health practitioners. Follow the data. Data driven. You cannot mislead when it comes to the data. So when you have those numbers, I know we're not epidemiologists, but we're always, as health departments, as state employments, different federal governments request those data, because there's always something showing proof of the need of the community. And one piece is always language access. Every office that we know of, even privatized, when we start looking at interpreting services and stuff, those agencies, they retain data. So make sure that you're asking for that data analysis in order to prove your point when you are working with those organizations. And I'm going to leave it at that. I'm sorry.
That is such a good point. So it reminds me of even when my position was created some 8 years ago, my supervisor wrote up a job description, a whole plan as to why this would be necessary for our very small school district. And she came with all the data, all the numbers. This % of families require interpretation translation. This percentage of the schools require this. We have this many bilingual folks who actually don't know what they're doing with interpretation and translation. That's why we need somebody. So if nothing else, if you have people who maybe don't actually care, but then you put the numbers in front of them, they can be very, very powerful for pushing people a little bit to get that funding or get the support that you're looking for. So thank you, Selma, for reminding me of that too.
Absolutely. We do have an interesting question from someone in the chat, and I'm going to push this towards Selma because he's talking about interpreter training. I know he mentions new language service providers. So we're talking about new interpreters. So I know you mentioned you do training. So when you guys are onboarding, Dale Lundstrom said, when educating new service providers like interpreters and translators, the executive order is something that comes up in trainings, especially when talking about language access law. How have you approached training about language access law for the upcoming generation of language service providers?
Dale, this is such a wonderful question.
I agree.
As I previously stated, I'm in public health, and my specialty is public policy. So I'm actually working on my PhD, which is in public policy and public administration. Earlier on, what we realized about 3-4 years ago, something that was missing when it came to the professional world, was the knowledge of knowing what is it that they're getting out of it, right? because we were advocating a lot for interpreting training. But what was occurring was within the state of Mississippi, I'm sorry, let me bald out with this region. What was occurring was we were training interpreters, but they were like, okay, I have this 40-hour certificate saying that I am now a professional interpreter. What do I do with this? So we started pushing on to reaching to different providers, different healthcare organizations, hospitals, nonprofit, of educating them of the importance of language access. Just how we were educating them on health equity, health diversity and inclusion, culture sensitivity, unconscious biases. Why not educate them on language access? Because when we compile language access overall, right, you start talking about the policies and regulations that all fall into it, but then you also put in there, why is it important to use an interpreter? What's the cause and effect of using a professional training interpreter instead of using the mama, the brother, the auntie, the neighbors, right? Start thinking about how that damage affects the fact that that person is not able to really have their own communication autonomy, and the fact that that child at school might be advocating for themselves and not really interpreting what he did wrong, right? Or how the mom is going to go ahead and obtain bad news and the child is the one who's providing it, the different trauma that we are causing to our children. So just, there is different trainings out there. I know I'm proponent on always speaking on it and creating different stuff. So I'm sure, Elizabeth, you guys will be sharing my information. Please reach out to me. I'd be happy to go ahead and put in a training for those whoever needs it on language access overall in general and what really intertwines in it.
Selma, I gotta say, I absolutely love that, because that is the piece that we work for as well. Like, that's why we're here right now. That's why we're here today, educating about the importance of language access. And I love that you guys took it on and you started just sending information and communicating and getting the word out. Did you see an active increase in people wanting to find those services?
Most definitely. So nowadays in the state of Mississippi, every hospital provider asks for interpreting certificates of training. So yeah, and those who are not trained, that they're just bilingual staff, they send them to the health department to get trained. But it was an effort. A lot of times, like I said, Hannah has a beautiful segue right now with her CEO, whoever is over her, because it takes those people to really believe the direction that we're guiding them in order to become proficient in what we do. It makes a whole lot of difference. But continue to talk and find different ways on how to relay the information, because that's a key part too, Elizabeth. We can talk about it, right? Mm-hmm. But sometimes it does not make sense to a person because they're monolingual. Yeah. So they've never gone to different ways. So I found a way to really mix the information, not just with my lectures, but also adding some visual pieces on them so it can start clicking and making sense to those who are listening the information.
Absolutely. I love that so much, Selma. That's amazing. Awesome. Hannah, anything to add there?
Not to that extent, because we're such a small network. I do the onboarding and do require that our interpreters, already be a professional interpreter. I'll do like kind of side trainings with any bilingual staff about best practices and that type of thing. But something this kind of niche doesn't really come up in those conversations.
Sure, yeah.
But yeah, it's something that seems increasingly important to be addressing. So
absolutely.
Great question, Dale, and thank you, Selma, for that answer.
Love that. Okay, we've got one last question, but I do also, after this, I do want to dig into a comment from one of our listeners. So, but no, I'll do the question first. Sorry. So what keeps you motivated in this work, and what advice would you share with peers navigating language access challenges and confusion after EOC 14222?
Hannah, you want me to go first? Or you want to
Uh,
go ahead
I
and go
can,
first.
whatever you want. I don't want to, I feel like you've gone first often, but if you're comfortable, go right ahead.
No, you can take it first.
Good.
I'm long-winded
No,
sometimes.
no, it's perfect. We love it. What keeps me motivated? Helping people. I think if you are in the world of language access, helping others is important to you, and you also probably love languages. So I am obsessed with Spanish ever since I was a little kindergartner, pre-K 4, 3-year-old. So being in a job that allows me to work in the Spanish speaking world and helping people has been very, very fulfilling. And yeah, there's just nothing like, sitting in a special education meeting, the family's confused, they're concerned, and, the meeting goes well and they walk out having complete, clear understanding of the services their child is receiving, how the teacher is working with their child, and you just feel like that you really made a difference and they're at peace and there's no confusion. Most importantly, no confusion. Confusion is our enemy in language access. So helping people is what motivates me. And advice, I don't want to beat a dead horse, but since there's no repercussions for still implementing language access except positive repercussions, do the best that you can do with what you have. And yeah, just keep in mind it's an executive order, but it really shouldn't change our day-to-day operations as long as we have people who believe in the same mission that we do, and we have all that good funding and everything. So
awesome. Thank you so much. Thanks, Hannah.
of course.
Selma?
All right. So what keeps me motivated is passion. I moved on to the field of public administration and policy making because I saw a way in a need that the community needed. I do believe that as an interpreter, I can make a difference, but I also believe that there's always have to be someone in the background pushing the needle, creating those policies, those laws in order to make a difference. So I love the communication piece. I love what makes the world go round and how it intertwines with our cultural, but ultimately seeing how we touch the community members without even being present. That's really what drives me. So.
I love that. That's beautiful. I want to just throw out here one of the comments here. Catherine Adames was supposed to be our moderator today. She is under the weather, lost her voice completely, but she's still with us in the comments. And she said, the first thing that she said, I'm going to come back to, but the second comment is just that it's such an emotionally wealthy job, and understanding that what we do makes a huge impact on people's lives is it's huge. It's a big part of why we do what we do, right? It's why we're here. There's one other thing, and I know we're so close on time. I got 2 minutes, okay? 2 minutes, but I think it's important. I was going to mention it earlier, but it just kind of like, where would it fit? Interpreters are finding other jobs because of the changes, because of fear, because of stress, and not knowing what comes next and what they're facing every day, even including with ICE and all of that. They're finding other jobs. They don't want to do it anymore because of these changes. As language access professionals, we have to continue advocating. We have to continue, like Hannah said, as Selma said, to grow our resources, continuing to make sure that providing language access, they are the key component there. If we don't have those interpreters, I mean, the deaf community is a perfect example. There are not enough ASL interpreters, period. There aren't. So when we see spoken language interpreters starting to move in a different direction, that's going to impact in a completely different way that has nothing to do directly with Executive Order 14224. It has everything to do with what we talked about earlier, that the court of public opinion and just how fearful, when we're talking about the ICE raids, we're talking about, just access in general. Where are we going? What's going to happen? And there's fear there. And I think that, as Hannah said, continue to provide those services, continue to build as much as you can, try to make a robust service plan and update those language access plans and make sure that you're on top of it so that these interpreters don't start looking somewhere else, because we're going to be in trouble. Anything you guys want to add about that?
Well said.
Okay. Well, I know we're out of time. Guys, thank you so much for this conversation. It was excellent. It was really what we needed to hear. I know, as we've already talked about, there's been a lot of uncertainty and fear and confusion, and it's just really great to bring you guys to the table and have this conversation. So thank you so much. Thank you so much to those that participated via the comments. We always appreciate having you, and we love the information that you share, the questions that you bring. So thank you for joining us today. Take care, everyone.
Thank you.
Thank you.